Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department reports hospitals are about to run out of beds for coronavirus patients as the country continues to tally more COVID-19 cases. Also, senators lament the seeming lack of focus in the country's coronavirus response and recovery in the president's fifth State of the Nation address. And lawmakers brace to investigate alleged widespread corruption amid the time of pandemic at the Philippine Health Corporation, or PhilHealth. Presidential spokesperson Harry Roque joins us live. President Rodrigo Duterte gets a near-perfect score for his State of the Nation address. At least that's from his spokesperson. Harry Roque says he's rating the president's SONA 9 out of 10. When asked what he found lacking, he said the speech was too long. He adds he would have put in more quotable quotes at the beginning and the end of the address. Meantime, the palace official also says there's no need to be alarmed by the rising COVID-19 cases in the country, even as the total number exceeded 83,000 on Tuesday. Let's go straight to the source of the story. We have presidential spokesperson Harry Roque. Secretary Roque, welcome to the show and maraming salamat po sa inyong oras.
Good morning, Pinky, and good morning, Philippines.
Secretary, yesterday in your briefing, tinanong ho kayo about the quarantine status, and you said yesterday that magkakaroon po ng meeting kahapon with, I believe, the DOH officials and probably some other officials. What was discussed yesterday, sir?
Obviously, I can't announce it, no, because it is the president that will announce it on Thursday, if I'm not mistaken. No? And there are still appeals to be made by the local government units. So the recommendations are all preliminary, subject to finalization on Thursday. But let's just say that things will not be the same. There will be major changes in our response to the pandemic. We now have the capability to conduct more actual testing. We will use our capacity to conduct more testing on a daily basis. We've hit more than 30,000 a day, and we will continue to test this many people on a daily basis. We will aim to test more, and we will invigorate our tracing, which is now headed by the tracing czar, Mayor Magalong. And on top of that, we will now be building more and more isolation facilities, knowing that the mild and the asymptomatics cannot stay home unless they have their own bathrooms and bedrooms. No? So it's not so much the classification that will matter, but the responses, no? The new invigorated responses that we will have to this COVID-19 pandemic.
From I understand, sir, from what I'm understanding from what you just said, it seems, I know you can't say much, sir, of course, this will be up to the president, but it seems that, from my understanding, sir, walang masyadong magbabago sa quarantine status. Ang magbabago po yung approach in testing, tracing, and treating. Would that be correct, sir?
That would be correct. The people will now see the difference in the response that we will have. It is now thoroughly invigorated, and part of it is we built capacity, and we now have the capacity to do what we wanted from the very beginning. So the people will see that there will be expanded targeting testing beyond numbers that they probably would not have imagined, and they will now see that government will be getting more and more isolation facilities. Around 1,000 hotel isolation facilities. If these are not enough, we will book dormitories, school dormitories, when school is still out. We will actually attempt to isolate everyone who will turn out positive, because the experience of other countries is it's only in this manner that they're able to control the spread of the disease. You know? So we have learned from
I
our
see.
experience here in the Philippines, and we have heeded also the advice of other countries, including places like Wuhan, as far as isolation is concerned.
So, with regards to the quarantine status, it seems like that's going to be the same. The approach on testing, tracing, and treating will be invigorated. It will be strengthened, sir. When we talk about testing, first and foremost, what would you say, what can you tell us would probably be, sir, the average tests conducted with this major change or with this invigorated, new invigorated approach to the testing, sir?
Right now, we've reached 30,000, more or less, a day. But we're going to get more. Why? Because in principle, we've agreed already to use pooled PCR testing. This means that one testing kit can now be used to test 10 up to 20 individuals. And the procedure is if all of them in the pool tested negative, then all of them are negative. But if the tests turn out to be positive, then every single one of the persons in the pool will be tested until we discover who the positive individual is. We isolate him, we trace the persons with whom he had contacts, and we will treat him. So the pool testing will expand our actual testing to at least times 10, no? Because the minimum of the pool that they're considering right now is 10. But there's a possibility that it could even be as high as 20, no? Because the prevalence rate in the Philippines is not yet as high as in the United States. No? In the United States, because the prevalence is very high, they can only pool test up to 5 individuals. But I think pool testing up to 10 individuals would be ideal for the Philippines. So that means we multiply by 10 our actual testing done in a day. No, if it's 30,000 a day right now, there's a possibility that we could do hundreds of thousands a day now if we utilize pool testing, and that's a difference in approach. That's a game changer because with having the capacity to test 10 times more than the current capacity, we're able now to isolate 10 times more individuals who tested positive for COVID-19.
And to be very clear about this pool testing, sir, I know you spoke to Secretary Vince Dizon about this, I believe, when you went to one of the testing facilities last week, Sec Roque. This means that if this was multiplied by 10, so let's not put it at 300,000, you said hundreds of thousands, would that mean individual tests, sir?
Yes, that is still considered individual tests, no? Because everyone will be getting swabs, and their swabs will be exposed to the same reagent to find out if anyone in the pool is positive. And if, as I said, if it's positive, then we find out who in the pool is positive. No? But if everyone is negative, that's negative then. So this really is a major game changer. So, to the 10 years, 19 years, will be multiplied at least by 10, no? Given limited resources. And secondly, thinking
Okay.
the cost
right.
will go down to 300 pesos. So that means anyone who wants to have a test can afford it because it's 300,000 pesos per test.
I lost you there. How much per test, sir?
Right now, the average cost for a PCR is 3,000. But if we use test also PCR, that goes to as low as 300 pesos. So now, limited going for
I'm
a
sorry,
test.
I'm losing Secretary Roque.
Very well for yes.
Secretary,
Maybe I
apologies.
should mic
You're
so
coming
that we
on
can
and
hear each
off, and
other.
sayang po yung...
Yes. Maybe I'll turn off my video
All right,
so that
let's try
it's
to
just
fix
audio.
that.
Yeah. I'm
Sige.
sorry, it's my
So,
wife's
sabi niyo po
picture
kasi,
on the
from what I heard,
screen.
no, Secretary Roque, ang sabi niyo
Go
po,
ahead.
ang PCR test ay 3,000. And because of this
Yes.
major change, it will be for, sir, ang narinig ko, 300 pesos ang PCR?
300. Oo, kasi there will be 10 people using one test kit. So it's divided by 10, so it will be 300 pesos.
I see.
So now anyone can afford to have a test. No? And you can imagine the results if we are able to test
Absolutely.
anyone who wants to be able to test it. We can isolate the positives and move on. As soon as we isolate the positives in a massive targeted testing that we're about to embark, you can see that the R naught, the case reproduction rate, as well as the case doubling rate will go down dramatically.
Secretary, just for clarification, pag mangyari po itong pool testing na kalalabasan nga is 300 pesos ang babayaran ng isang tao, saan ho ito maa-avail? Because there's so many questions, sir. There was actually a message on Viber that was being passed around kung kung saan at sino yung pinakamura. At doon po sa nabasa ko, Sec, and please correct me if I'm wrong, ang lumalabas po yung Red Cross ang pinakamura, and that was about, if I'm not mistaken, sir, 4,000.
Hindi naman po, no? Kasi meron tayong Project ARC, and Project ARC is a project of the private sector in cooperation with the government. And they have been donating PCR machines, no, to public hospitals. And when you go to a Project ARC beneficiary, the test costs anywhere from 1,750 to 2,000. No? So marami pong mura yung mga libreng machines na donate ng Project ARC. Pero ang punto nga po, if we resort to full testing, it becomes even cheaper. So
Secretary,
actually,
when can this happen? When will this happen?
Okay, they're now on pilot study. No? They have actually concluded pilot study in children's memorial.
Secretary, apologies. We're really, we don't have a very good signal. It's best, we're going to take a very short break. If we need to have Secretary Roque on the phone so that we understand him better, let's do that. But in the meantime, let's take a very short break. The Source, we'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Presidential Spokesperson Harry Roque. Secretary, I'm sorry, but we're going to have to do this again because the line wasn't very good. So sabi niyo po, major changes. Just so for clarification, in very few words, sir, ano po yung major changes that we can expect after July 31?
Massive targeted testing involving full testing that would multiply our actual testing by at least 10, no? And that would reduce the cost of PCR testing to as low as 300 pesos per person. In addition to that, we will have reinvigorated tracing using the methods of Baguio City Mayor Magalong. And in this regard, you know, we're not just going to rely on individuals who are paid to become tracers. We're going to build an army of volunteers, no? Courtesy of training materials to be provided by Mayor Magalong, no? So that we can intensify tracing, hopefully do as Thailand and Vietnam did up to the third degree of tracing. And in this regard, I will tap you, Pinky, to be one of the trainers, no, for the trainers, no, and hopefully we can devote one of your program later on actually training individuals on TV on how they can effectively become tracers, no, with or without payment, no. And on top of that,
let's do that, sir. Let's do that.
Yes,
okay.
Who is the isolation czar, has committed to build more and more isolation facilities now that we know that home quarantine should not be resorted to unless you have your own bedroom and bathroom. No, we are looking at another mega isolation facility, which is the facility in Nueva Ecija, which used to be the drug rehab center that's going to open soon. And we're looking at more isolation facilities, so even in Metro Manila. And then we have Secretary Vega, Yusek Vega, our treatment czar, that will rationalize actually hospital beds and ICU beds. If the hospital beds and ICU beds in Manila are at critical level, we will tap even the bed capacity of neighboring Region 3 and Region 4A to refer patients to these vacant ICU or hospital beds. No? So there is now a one hospital action
very quickly, sir,
inaugurated in MMDA, which is headed by Yusek Vega.
Kailan ho mag-uumpisa itong pool testing? Doon po tayo naiwan before we went on a break, sir.
Mm-hmm. We're done with pilot testing, and yesterday in the IATF meeting, I really prodded the DOH to actually allow further pilot testing. No? So I think what will happen is we will have pilot testing immediately after the new classifications are announced, and this will be a joint effort of the government and private sector through Project ARC.
I'm assuming, Secretary Roque, that the quarantine status stays with how you're describing everything to me right now, sir.
I can't preempt the president, but let's put it this way. No? Sometimes we have to rely less on classifications. We need to be more innovative in our response. We acknowledge that the numbers are rising. We do say that what really matters is the
Okay.
mortality rate, and the mortality rate is below world average. We're more or less around 2%. So we can't say we've been an absolute failure,
Two.
but we do know that efforts will have to be done to reduce the numbers and, if possible, no, to do away completely with community transmission, which can be done under this contemplated massive targeted testing and invigorated tracing, as well as expanded isolation facilities.
So, so if we are not an absolute failure, sir, what are we?
I think we've been rather successful because we've limited mortality rates, and in the end, that's what matters. How many people perish because of the pandemic? I think the strides also in treating COVID has contributed to this fact that mortality is still way below the world threshold. We can only look at our former colonial master and look at the mess that they're in, the United States, no, and even England. No, we're far shot from the crisis that they have in the U.S., in England, and the rest of Europe. No, and I keep on telling people, do not forget that the same UP Octa Research Group that is so accurately forecasting the numbers of COVID-19 forecasted it should have been 3.5 million or even more by now if we did not resort to the steps that we did. So people, let's give ourselves credit because it's not just government that succeeded. No, it's the Filipino people that
Right.
succeeded to be where we are.
Here's an argument, though, sir, that I want to bring in. This is from Governor Cheese Escudero. That argument that you use, sir, I'm just going to relate it to what he said. The "it could have been worse" argument is actually a fallacy designed to make people feel good and content with whatever is given them. We can and should demand more from our leaders who I believe can and will do more. Di na dapat, pwede na. That's what he said, sir.
Well, you don't have to demand because we're doing it. No? Please remember that IATF is not just a DOH, it's a whole of government approach. And the fact that we have reached the point where full testing is now actually in principle allowed, no, shows the stride that we have made, no, in breaking barriers and in accepting new ideas. No.
Right. Okay.
Please remember that even on rapid testing kits, it had to be the president order the use of rapid testing kits because until the last minute, no, the Health Technical Advisory Board under the Universal Healthcare will not authorize even the purchase of rapid testing kits. No? So we are achieving great strides. And as soon as we fully implement this pool testing, you will see a major decrease in the case doubling rate as well as in the R0 or the case reproduction rate.
Okay.
Well, of course, I
You
need
talked
to stress
about
that people
also
still need,
UP,
people still need to
yeah,
resort to
the health protocols,
social
sir. Wash your
distancing,
hands,
yes, washing
social
of hands and
distancing,
wearing of masks.
wear your
Although,
masks. Okay.
as in our last conversation, there was an international survey which shows that pretty much people do it, no? Except that it's still not 100%. So we should
Yeah.
strive for 100% wearing of masks and 100% washing
So
of
that
hands and
was,
social distancing. Yes.
yeah, that was a UK study, sir. Let me move to this. COVID-19 now at 83,000, over rather, 83,000. The country, more or less, sir, the past couple of days was recording about 1,500, 2,000, thereabouts, sir. This doesn't look like, this time, sir, it doesn't look like we're going to beat this UP and UST prediction of 85,000 by the end of July, sir.
Well, I'm sad to say we're not. And to those who were made fun of my excitement, well, you got what you wanted. The forecast happened, and I see no reason why we should celebrate. No, it's very sad, but as I have conferred with Professor Ranjit Rai, we should always aim to beat the forecast because we have the tools. And secondly, it can happen no? Because it happened in Cebu already that they were able to reduce the transmission. And since Cebu was able to do it, we should be able to do it in Metro Manila as well.
There's another topic that needs to be discussed. There's actually a lot, sir, but in relation to what you're saying, the testing, tracing, and treating. I want to talk about the DOH update on hospital beds, but we're going to have to discuss that rather after a very short break. We'll be right back. Welcome back to The Source. Secretary Roque, we have this from the Inquirer. Please confirm the IATF has approved the reopening of more businesses in GCQ areas, which include review centers, gyms, internet shops, personal grooming services, and drive-in cinemas. DTI Secretary Ramon Lopez tells Teleradyo. He says this is effective August 1. Can you confirm, sir?
Well, Secretary Lopez said it, but my official statement as IATF spokesperson will be released anytime now. And I would rather wait for the actual release of the statement because there's quite a list of industries that have been reopened, and I don't want to make a mistake.
Yeah, but sir, lumabas na po eh. Just
Yes.
confirm it, sir.
Yeah, well, I'm confirming that there's a lot more that was opened
So it's
by
true.
recommendation of the DTI. But the actual, I hesitate to actually enumerate them because I may miss or I may make a mistake. But I think a few minutes from now, the official release as IATF spokesperson will be coming out.
Okay, sir, let's talk about this very, very important. So major changes. We're going to test more. If you test, you need to treat. So dito po tayo sa treat. You need to isolate them and treat them. Okay, you talked about isolation already. Sabi mo from Secretary Villar, more facilities will be open. Here, the DOH update as of July 28. Help us understand the situation, sir. When we talk about hospital beds, and I'm only talking about NCR, ICU beds at 69%, sir. Isolation beds at 82% and ward beds at 89%. Here's my question, sir. With targeted testing, definitely we will find more infected and possibly have to hospitalize those severely and severe and critical cases. Sir, hindi ho ba medyo nauubos na po yung mga ICU beds and isolation beds natin? Imagine that at 82% and ward beds at 89%.
Well, the reason is because hospitals only allotted for government hospitals 30% of their bed capacity and ICU capacity to COVID patients. And the private hospitals are not even able to comply with that administrative order of the DOH. They have pleaded that they will remain at 20 for various reasons. No? So what's the solution? The solution is to at least increase COVID bed capacity to up to 50% in all government hospitals, and for private hospitals to at least comply with the 30% allotment. No? The percentages seem dire. It's because it's reckoned only from a 30-bed capacity allotted for COVID patients. So if you double that capacity, obviously the percentage will reduce. No? From 80, it will be around 50%. No? So that seems to be the solution, and that is something that USEC Vega is undertaking now. I think the one hospital command center has been rather effective because it works as an effective referral system. If COVID capacity for ICU, for instance, in a private hospital in Quezon City is already full, then they can refer the patient to a neighboring hospital that has still a vacancy. No? It's actually just coordinating who's got the space, no, so that the patients can go there. But another milestone, of course, is that in the treatment of COVID, we now have a lot more experience. We have Remdesivir, we have Avigan, we have now the cannula treatment instead of the ventilators, which have really proven to be life-saving, more than ventilators have proven themselves to be effective. No? And, of course, we're not discounting the fact that soon there will also be a vaccine.
All right, Secretary, thank you. We're going to have to talk again because I have a lot of other questions with telcos, the President's SONA, and China as well. And of course, this supposed audit, this call for an audit for the funds of COVID. But wala na po tayong oras. But I need to bring this in, sir, because it's coming from the netizens. Ang tanong po nila, maybe you can just give us something. Will Metro Manila shift back to MECQ? Ito na lang po yung tanong, malaki ho ba daw yung chance?
Metro Manila will be a living experiment. And it's an experiment that we believe we can be successful at, and it will be something that we can be proud of.
Is the experiment shifting to MECQ?
Ikaw talaga. If I were to answer that, then that precludes already the president. No.
No,
We
yeah,
know
but
already
ang
what to
tanong
do.
po nila, malaki ho ba ang chance? Malaki ho ba ang chance na bumalik tayo sa MECQ? I guess you can just
Okay,
answer
maybe this
malaki
is
o
how I
maliit,
will
sir.
respond it, no? Dalawa kasi yung criteria, no? The case doubling rate, and our case doubling rate is fine. We're now at 8.9, no? We actually improved because the higher the case
8.9.
doubling rate is, the longer, no, is the better. But it's, as you mentioned, it's critical care capacity that's the problem, no? Because ICU beds, we have reached mga around, as you said, no, around 18, no? But there are steps that can be done. Rationalization of hospital beds, including ICU beds, is a solution. And if we have to, we will build more ICU beds, really, no? For as long as the case doubling rate is under control. Okay?
Okay. So the answer to that, sir, is?
I'm still not going to say it because the president will be the one to announce it. Okay? Okay.
All right. I tried my best to the netizens. I tried my best, but he doesn't want to say anything about that. But it seems from my understanding kay Secretary Roque, it seems like we're staying. Parang status quo tayo. No, Sec? Parang
Hindi
status
po.
quo.
Definitely, it's
Parang.
not going to be status quo. No, it's not going to be status quo. Nothing will be status quo from this classification.
Okay.
There will be, things will not be
Right.
as
Wala na
usual.
po talaga tayong
Things will
oras.
change.
Thank you.
Yes.
Okay.
Okay. Thank you
All
very
right,
much.
to Presidential Spokesperson Harry Roque. Sir, maraming salamat po sa inyo. Thank you. Ingat po kayo, sir. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.